Now, medical tourism abroad on account of the poorly equipped hospitals and other medical facilities seems to sum the state of affairs in Nigeria's healthcare sector. But the Chief Medical Director of the Federal Medical Center, Abuja, Professor Saad Ahmed, says the negative narrative on the country's healthcare delivery system can now be reversed to bring about a change in fortunes for the sector. Galaxy's Godfrey Eshemuge completes the story.
Having poorly equipped hospitals has always been an excuse for many, particularly the elite, to leave Nigeria for medical treatment in other countries. But key stakeholders in the country's healthcare sector have often restated that there is all it takes to become a major healthcare destination for citizens and for visitors from other countries. One of these stakeholders is Professor Saad Ahmed of the Federal Medical Center, Abuja, who says the Buhari-led administration has in the past 2 years done so much to reposition healthcare. One of the testaments to this is that the FMC Abuja will in about a week begin open heart surgery.
We are trying to address the issue of medical tourism because, for example, I talked to you about open heart surgery. You can do it here now. Within the next 1 week, we are starting. Laser surgeries, we do it here. Arthroscopy, laminectomy for spine surgeries, and all of that. Those that want to do general medical checkup, we have actually all the equipment on ground. I bet you that the investment the federal government made in the health sector within the last 2 years is quite enormous, and every health facility should be able to showcase what they have and what they can do.
But despite the seeming gains recorded at the FMC, the issue of brain drain has been intense, and the task of seeking ways to fill the void left on account of doctors leaving for greener pastures remains a major preoccupation for Professor Ahmed.
Brain drain is one of the serious challenges that we are equally facing because I know the number of doctors, nurses, pharmacists that left this place within the last 1 year, quite a number. And I think it's part of the things that Reform Committee is going to look at, because we plead as health sector, we should be given some leverage to replace those that are leaving in order not to break service. For example, you have, let's say, one orthopedic surgeon in your facility, and that person suddenly is leaving for the UK, US, or wherever.
A cross-section of medical professionals at the FMC say some of the specialized services they deliver to persons in their quest to save lives.
The colonoscope is usually used for lower endoscopic procedures. If they are suspecting maybe cancer of the rectum, the cecum, or the intestine. But these two endoscopes, we have them available here, and there's also a tower. So what we basically do after the procedure, we record our cases and give the patient the result. Immediately after the procedure, we just give the patient the result for further investigations.
And the patients too are not left out.
The treatment that I've received is top-notch. Other hospitals, other private, they do, but when it comes to FMC, they do a very good job. And at a minimal, not at the same price that you get it for, like Nisa and Co.
I have to pay 1.5 to see a consultant. On a good day, if I go to private hospital, I have to pay like 20,000, 30,000. And when I have complaints, I know where to go, and they just attend to me immediately. Yes.
Ending medical tourism and keeping our best medical brains in the country may seem a long way off at the moment, but it is achievable in the long run. Godfrey Eshemuge, Galaxy News, Abuja.